24 hospitals across the country targeted by hate for providing gender-affirming care. Healthcare providers in 21 states have been hurt by online harassment campaigns. According to the Human Rights Campaign, some patients and families have been unable to get care. Bomb threats, harassment, disinformation. Children's hospitals have experienced all of these in recent months as they seek to provide gender-affirming care. According to the report published by the HRC Foundation on December 13th, between August and November, 24 hospitals and healthcare providers in 21 different states have been targeted in coordinated online harassment campaigns. Kelley Robinson, president of the Human Rights Campaign, said, quote, "This report confirms what we have suspected for some time. These dangerous accounts are playing a major role in causing harm to healthcare providers and patients," end quote. Adding to the problem, politicians seize on the false claims and repeat them to score points with constituents. Ugh. The Human Rights Commission said, some elected officials are going further. In some cases, healthcare providers are curbing services due to the threatened loss of funding. The University of Oklahoma Medical Center stopped some transgender health services for those under 18 after Oklahoma Governor Kevin Stitt threatened to withhold $108 million in aid. Such threats and actions impede care to all families. The Human Rights Campaign also released a video featuring Angela Gepford of Children's Minnesota, who talked about the attacks and threats aimed at doctors in pediatrics.
Pediatricians are pretty beloved. I mean, we're the people out there with, the soft voices and the bow ties and, smiles and pinwheels and things like that. And you don't go into pediatrics really expecting to be attacked for the care that you provide.
In recent weeks, several children's hospitals have become targets of far-right attacks.
The FBI has arrested a woman for making bomb threats to the Boston Children's Hospital.
A growing number of doctors say they are under threat from far-right activists because they care for transgender patients.
There's sometimes attacks on health systems, people contacting to complain or share comments that are threatening, like bodily harm should come to me for the care that I provide. It's shocking. It's just never something I thought would be part of my career.
Yeah, this drives me absolutely crazy. Number one, because healthcare clinicians are only trained to help people.
They take an oath.
Well, we take an oath, but also that's all you know. Like, we don't know anything about politics, nor do we care.
Right. Yeah.
We don't ask, when you come into the emergency room, nobody goes, what's your political party? Or like, do you believe in this? Or do you have a God? Like,
what
do
you need?
Exactly.
How can we save your life?
Literally, we don't even, those things never enter your mind. The other thing, and so for the clinicians stuck in, and I know many, in a position.
How long have you been in the healthcare field?
Over 30 years.
Okay.
And so people just trying to do their jobs are now afraid to go to work and do that and save your life.
Yeah. Right.
You know what I mean? It's
And save
do
your
we
life.
save their life or not save their life?
Yeah.
Like, what do we do
Isn't
here?
that crazy that now they have to question themselves if they should save somebody's life or not?
And what's even crazier is people's health and health care is a personal, private matter.
Right.
And who is anybody to make a decision? And this is across many issues. To make a decision for somebody else based on a healthcare issue. It's beyond.
Yeah, I'm very frustrated with politicians being so involved in actually how healthcare works.
Yeah.
And people's
that should be divided in some way. Like it should.
They can ask for your guidance, but if you ask for their guidance, the American Psychiatric Association, like all of these medical associations say you should be giving transgender care, right? And then it wouldn't be an issue.
Yeah.
And yet politicians somehow have this ability to overrule all of that.
Yeah.
And put
Overrule
people's lives
science. Overrule science.
Well, I remember.
Did you ever imagine we'd be living in a time when healthcare workers and librarians, their lives are at risk. I mean, come on.
Well, so I have many folks in my chosen family and regular family. You guys all know my wife is a nurse practitioner, and so we had she had the holiday party recently, and I sat around with a table full of nurses and doctors and people who save lives daily, right? And of course we started talking about DeSantis. Is what you start talking about, right? And I really was expecting these people to say, F him, and I'm going to do what I want to do, and I took an oath, blah, blah, blah. No, folks, these people are scared. And they really do feel that DeSantis will become president and then come after them for just giving gender-affirming care to people. I mean, so it's their livelihood or the fact that they just want to help people, right? Like, that should not be a choice that they have to make.
Absolutely.
And the more horrific part is that we have regular citizens trying to calling in bomb threats at healthcare facilities, at children's hospitals.
Right.
You talk about saving the children, but yet you want to bomb the children. This makes absolutely no damn sense.
Well, they don't make
And then the politicians stand behind them by encouraging the rhetoric.
them. Yep, opening the door for it.
Political points to put so many lives at risk. I just think something is beyond wrong with this. Like somebody needs to step in and start to put some controls on these politicians.
Well,
why? Because you're a politician, you get to just do what you want.
The only people that can put controls on politicians are politicians, so it's never going to happen.
Right.
And
Or the voters. We can vote them out.
That's exactly right.
yeah, but
I'm with you, Cindy.
yeah.
I'm with you, Cindy.
I mean,
We have to do something.
if they wanted to do it, they would have done it a long time ago.
Yeah.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Lara are loud. We need passionate allies. Happening Out television network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.